is important to be aware of the signs and symptoms of anaphylaxis, especially if someone you know has a severe allergy. Some signs and symptoms of anaphylaxis are flushed skin, shortness of breath, difficulty breathing, hives, abdominal pain and cramps, and angioedema. Angioedema is swelling of the deep tissue and the mucosa membranes.
I'll call 911 and I'll get the EpiPen. My friend's going into anaphylactic shock. I need an ambulance. Come now. How do we know she's in anaphylactic shock? Her skin is flushed, she has hives, and she's wheezing.
EpiPen is to be administered in the outer aspect of the patient's thigh muscle. It can be ejected through clothing if needed. After giving the EpiPen, it is important to still call 911 or go to the nearest hospital, even if the patient's symptoms subside. Further medical treatment may be necessary. The EpiPen can have major cardiac side effects, so monitoring closely for those signs and symptoms is important.
Here, give her the Epi. Hi, my name's Stephanie and I'll be your nurse. Hi, today I'm Tina. Hi. Have you had any allergy tests in the past? Yeah. What are you allergic to? Peanuts and eggs? Okay.
Allergen testing is performed via a scratch test or puncture test on the patient's forearm. The patient is punctured or scratched with up to 40 different types of popular allergens. In this case, her allergen testing revealed she's allergic to both peanuts and eggs. Allergen testing plays a crucial role in identifying allergens that can lead to anaphylaxis. This allows the patient to avoid such allergens and therefore avoid anaphylaxis.
And can you take a deep breath, please? Again. Okay, can you lean forward, please? Take a deep breath. Can you take another deep breath? Thank you very much. And can I listen to your abdominal sounds?
The physical assessment of a patient with anaphylaxis would likely reveal the following: a rash covering a portion of the patient's body, usually accompanied by extreme itching. Tachycardia is usually also present in response to the epinephrine administration. O2 is usually given to a patient via nasal cannula to help with wheezing or shortness of breath. A patient with anaphylaxis may also have a low O2 saturation and high respiratory rate. This is due to the severe laryngeal swelling and edema. Abdominal pain and distension is common while the patient's body is attempting to digest the allergen. Generalized body weakness is also accompanied in anaphylaxis.
Any pain? Yeah. Where is the pain located? I have abdominal cramps. Abdominal cramps. Yeah. And on a scale of 0 to 10, where would you rate your pain? Like an 8. An 8. Okay. Would you like me to ask the doctor for something for the pain? Yes, please. Okay. You're itchy too? Okay. Well, the doctor ordered some hydrocortisone, and that will help with that.
Pain medication may be given to relieve the abdominal pain accompanying the anaphylaxis. Benadryl is a common medication given to help reduce the laryngeal swelling and edema. Hydrocortisone is often accompanied to relieve the hives and itching. Epinephrine triggers a sympathetic response, increasing the patient's heart rate, making EKG monitoring crucial for a patient receiving epinephrine administration. O2 via nasal cannula is given to increase the O2 saturation and tissue perfusion. Patency of the airway is vital for survival, so in extreme cases, intubation may be necessary.
It is also important to make sure that you check all food labels when you're eating so you know exactly what you're ingesting. As well, always keep your EpiPen on you.
If an EpiPen is prescribed to you, make sure to carry it on you at all times. It is also very important to educate your friends and family on EpiPen administration in cases where you are unable to give it to yourself. Always check food labels for allergens. Avoiding your known allergen is the #1 prevention for anaphylaxis.
Listen, baby, ain't no mountain high, ain't no valley low, ain't no river wide.